Hi and good day, my name is Amalina. I'm going to present on respiratory system and the most common occupational lung disease. Respiratory system is a system consisting of specific organs and structures used for gas exchange in human, mainly to bring in oxygen and remove carbon dioxide from the body. Before we begin, let's learn a bit on the basic anatomy of the lung. So the lungs weigh around 1,200 grams, and the main structure would be trachea, which further divide into right primary bronchus and left primary bronchus on each side of the lung. The bronchus then further divided into smaller branches called bronchiole. At the end of bronchioles, there are millions of alveoli. On the right lung, we have three lobes, the upper lobe, middle lobe, and lower lobe. Meanwhile, on the left lung, we have the upper lobe and also the lower lobe. Respiratory system can be divided into conducting zone, which contains structure that provide passageway for air to travel into and out of the lungs. Meanwhile, respiratory zone serve as the site of the gas exchange. Conducting zone consists of nose, pharynx, which is the throat, larynx, which is the voice box, trachea, bronchus, and bronchiole. So these are the passageway for air to travel in and out of the lung. Meanwhile, the respiratory zone consists millions of alveoli, which are surrounded with massive network of blood capillaries to provide blood for the gas exchange. Breathing is the process that facilitates the movement of air in and out of the lung. During inhalation, the diaphragm contracts and the rib cage expands, which increases the lung volume. Consequently, the lung pressure decreases, so the air is drawn into the lung. Meanwhile, the exhalation is the opposite to inhalation. That's why the air is pushed out of the lung. The main function of respiratory system is of course to supply oxygen and remove carbon dioxide. But there are also other functions, for example smell due to the presence of receptor inside of our nose, and also speech due to vibration of the vocal cords and together with the movement of the tongue and lips to produce speech. Okay, now, so what is occupational lung disease? It is a disease that is caused by exposure of lung to irritants at a workplace. And there are a lot of occupational lung diseases, but I have listed here the most common one. The first one is pneumoconiosis, which is a lung disease due to accumulation of dust in the lung, which over a period of time can cause damage to the lung tissue. The site of injury may be dependent on the size of the particle. For example, larger particles will settle on the upper of respiratory tract, for example, the mouth, the throat, while the finer particle will settle in the trachea and bronchus, and the ultra-fine particles will settle deep down to the level of alveoli. And the most common one is cold walker pneumoconiosis, which is caused by inhaling coal dust, also known as black lung disease. Also asbestosis, which is caused by inhalation of microscopic fiber of asbestos. Both of these conditions can cause permanent damage to the lung and ultimately may also lead to lung cancer. Another example would be silicosis, which is caused by inhalation of free silica, mainly affect workers in pottery or ceramic industry, and also bisiniosis, which is caused by prolonged inhalation of cotton fiber, which commonly affect workers in textile industry. The other type is called hypersensitivity pneumocystis, which is a lung disease caused by the inhalation of fungus spores from moldy hay, bird droppings, and other organic dust. The famous one is farmer's lung from moldy hay, and also bird breeder's lung from bird droppings, commonly from pigeon or parakeets. There is also injury due to fumes and vapor inhalation, where irritant gases can cause direct injury to the respiratory tract, for example, inhalation of chlorine and ammonia gas, while toxic gases can cause direct harm as they displace oxygen and cause suffocation, for example, carbon monoxide gas inhalation. And the last one is infectious lung disease, which is very common at the workplace, and the risk can be based on the type of work being performed, the kind of interaction with people, and also the working environment. And these are the common infectious lung disease. The first one is tuberculosis caused by Mycobacterium tuberculosis, and the second one is the famous one now, which is the COVID-19 caused by SARS coronavirus 2 virus. This disease can spread through cough, sneeze, and especially when the safe physical distance is not being practiced. So this is the end of my slide. There's not much that I can put due to time limit, but I hope everything is sufficient. But if you guys have any other question, feel free to ask me. Thank you.